Kelly Ronahan is a Canadian woman whose medical case becomes widely known because of how extreme and unusual its progression is over time. Before any visible decline, older videos and photos show a very different life. Kelly dances ballet. Ballet requires strength, balance, coordination, and full use of the legs. These clips show a body that works and a person who is physically capable and disciplined. Her social media also shows a strong affection for animals. She posts about them frequently, suggesting routine, care, and emotional connection. At this point, her life appears ordinary and stable. Nothing in these early images suggests what is coming. Mixed in with these everyday moments, however, are signs of medical involvement. Some posts show Kelly in hospital settings, including receiving blood transfusions. Blood transfusions are not minor procedures. They are given when hemoglobin levels drop dangerously low, most often because of severe anemia. This indicates that, even early on, her medical situation is serious enough at times to require urgent stabilization. Her life appears to move in cycles. Periods of normal activity are followed by sudden hospital care, then a return to everyday life. In her social media bio, Kelly lists several diagnoses, including Behçet's disease, anemia, and multiple sclerosis. Behçet's disease is an autoimmune condition that can cause inflammation and ulcers. Multiple sclerosis affects the nervous system. Anemia affects the body's ability to carry oxygen. These diagnoses explain why she is frequently under medical care and why blood transfusions are necessary. They confirm that her medical treatment is real and ongoing. However, they do not explain what begins to happen next. Over time, Kelly develops wounds on her legs. At first, they appear serious but not catastrophic. Medical treatment is attempted. Wound care is provided. Hospital visits increase. Instead of healing, the wounds worsen. They grow larger, deeper, and increasingly resistant to treatment. The deterioration is not subtle. It is obvious and progressive. What stands out is not only how severe the wounds become, but how unusual they are. The shape and placement of the injuries do not match patterns typically seen in vascular disease, autoimmune ulcers, or accidental trauma. They are sharply defined and localized in ways that raise concern. Large areas of tissue are affected. Normal healing does not occur. The wounds persist and worsen despite continued care. Doctors investigate extensively. Infections are tested for. Autoimmune causes are reconsidered. Circulatory and vascular problems are evaluated. Rare conditions are explored. Despite these efforts, the damage continues. In some cases, the wounds worsen even while Kelly is under medical supervision. At this point, the situation becomes clear. Medical treatment is offered. Wound care is provided. Recommendations are given. The outcome does not change because the behavior causing the damage does not stop. The injuries continue because of Kelly's own actions. Doctors are able to treat the consequences, but they cannot stop the damage as long as it is being actively caused. This is why the condition escalates instead of stabilizing. After long-term observation, documentation, and evaluation, medical teams reach a conclusion that is serious and difficult to make. They determine that the injuries are self-inflicted. This conclusion is not made casually. In medicine, determining self-inflicted injury requires ruling out physical disease and identifying consistent patterns in wound appearance, progression, and response to treatment. The diagnosis most commonly associated with cases like this is factitious disorder. Factitious disorder is a psychiatric condition in which a person intentionally causes or worsens illness or injury without external reward. The harm is real. The medical consequences are real. In Kelly Ronahan's case, the destruction to her legs continues to escalate. Tissue damage becomes extensive and irreversible. Blood flow is compromised. Infection remains a constant risk. Healing is no longer possible. Medical intervention shifts from trying to save the limbs to preventing life-threatening complications. Eventually, the damage reaches a point where limb salvage cannot be achieved. Both of Kelly's legs are amputated because they can no longer be saved. The amputations are not a cure. They are the final outcome of prolonged and severe physical damage. Following the amputations, Kelly is placed into long-term care. She stops posting publicly, and verified information about her current condition becomes limited. What happens after that is largely unknown. The absence of updates does not mean the situation is resolved. It only means it is no longer visible. What makes this case unusual is how much of it is documented. Unlike most medical cases, much of Kelly Ronahan's progression is recorded through videos, photos, and posts shared over several years. An active life, intermittent medical crises, escalating and unusually shaped wounds, progression despite treatment, and permanent physical loss. Most cases like this unfold behind hospital doors. This one unfolds, in part, in public. What is known ends where the documentation ends, and that is where Kelly Ronahan's case currently stands.